Hey everybody, it's Peter. I'm going to take my mask off now. I'm at DCMH right outside of where the babies are. This is going to be a fun episode today. But today's subject is awfully serious. It has to do with baby safety and how it is we make sure that while they're sleeping in the safest of all positions. I'm joined today by Rosa Amato over my left shoulder, right? And we're trying to keep a little distance here, right? And Karen Angelillo, right? And I'm going to step off camera and maybe ask some questions. They're prepared to tell you about some really cool stuff and some certifications we have here. So I'm going to let them take over from here.
About 7, 8 years ago, Karen came to me and said, I really think we should be a safe sleep hospital and should get certified. And I said, okay, what does that mean? And there were 3 levels: bronze, silver, and gold. We contacted PA Safe Sleep and Cribs for Kids, and they gave us a list of what we needed to do. We needed to educate the staff, mandatory education each year. We had to model behavior. We had to submit for a year. We had to do audits. And then afterwards, we were very fortunate we were able to be bronze. But I want to go back a moment and let Karen explain what her conversation was with me that got us started.
Started in the 1990s. American Academy of Pediatrics started looking at positioning and how it affected sudden infant death syndrome. They had looked over in Europe at some studies, and then they did studies here, and they found that babies who were sleeping on their stomach had a higher rate of sudden infant death syndrome. So since about 1992, the American Academy of Pediatrics stated that babies should be on their back for safe sleep. And since then, the program has grown so that not only do we emphasize back to sleep, but we want the babies alone in their crib, not sleeping with anyone else, such as a family bed, and also in a crib that's uncluttered so that they don't have extra blankets, pillows, bumper pads, things that could cover their face when they are sleeping that could endanger them.
There are a lot of misconceptions. You know, over time, healthcare changes. The more we learn, the more we share. Years ago, my guess is when I was born, this was not really a commonly understood situation.
When we first started doing this program, we had education from the Eunice Kennedy Shriver Institute, which promotes safe sleep. And we had all the staff reviewing that education. It was one of the first things we did in order to get the bronze certification. We had a unit clerk in our unit that looked at the education and said she works at a daycare and they were putting all their babies on their stomachs. So she learned from that education, took it back to the daycare center that she worked at, and they instituted a change so that babies were always on their backs.
That's so cool. My guess is that saves some lives.
Yeah, that's what our goal is.
In all hospitals, maternity units give the parents a form that comes from the state. They sign a copy, you keep a copy. We do a couple other things. We have the newborn channel, and it's a series of 8 hours. It repeats 3 times over the 24 hours, the whole series. And there are programs on preventing SIDS, preventing shaken baby, things like that, safe sleep practices. And the mothers can actually watch that at home with any family member for 3 months.
We did have certainly displays out here because prior to COVID, we had family members always waiting out here for the delivery of their new baby. And hopefully they would look at these displays and learn a little bit about back to sleep and safe things that they could do.
And then we also have posters in every room, in every labor room, in every patient room. We talk about safe sleep. And there's a poster that actually shows it so that you can see that truly it's just a baby in a crib. No bumpers, no blankets, no stuffed animals, just a baby in a crib. The staff, they do the education, they're happy to do the education, they answer questions, and they model the behavior. And that really is the most important, is staff modeling behavior for the parents. We have a certification of completion from PA Safe Sleep. If I could show off our big, beautiful silver certificate.
Beautiful.
Yep, and we're hoping for gold in the few years.
And here is our certification, right? So this is up for grabs again now, right?
Yes.
In November.
In November, around
Right.
Thanksgiving, yes.
I think those of you closest to the patients really have the opportunity to feel what it's like to save a life or to provide hope to somebody who's begun to lose hope. So God bless you guys.
Thank you.
Keep doing what you're doing. Thanks for helping us out. I know you came out of retirement to help us. Is that right?
Yes, I did.
All right. So as we always do, right, and I'll stick my head back in here, be well, do good, and we're all counting on both of you to get us that certification again. Thanks, guys. See you soon.